All right. So welcome again, folks. Let's go ahead and start with lightning rounds. If you have an announcement that you would like to share with the group, feel free to use the raise hand button. And when I call on you, you can identify yourself and just, try to keep it to 30 seconds so that we can make it through our agenda today. All right. So if there's anybody that has something that they'd like to share, now is your opportunity, your moment of fame. I'm sure there's someone who's got something. Stephanie, are you raising your hand or is that a, yeah?
Thank you. I am, and I'm fumbling with all of my devices this morning, but I'm not even ready to quite share it yet. But I am really pleased to invite all of you to an event this later in March, later this spring, called Partner with Pacific, in which we are welcoming new partners to learn a little bit more about ways to get involved with the university and to host students as interns, practicum students, job sites, what have you. And I will put the link to that event in chat so you all have a little bit more information, but would love to have you join us. Thank you.
Thank you, Stephanie. For those of you who don't know, Stephanie is a brand new board member of VANS, and we're very happy to have her join us. Anyone else? And I can't see everybody on the screen, so using the raise hand button is going to be the best way to get my attention.
I want to introduce myself. Can you all hear me?
Yes, Cindy,
I'm
go ahead.
having electronics difficulties as well. So now you're on my phone and I can hear almost. But my name is Cynthia Miguel. You're free to call me Cindy. And I have been with Salvation Army for many years, but we are just starting a brand new Pathway of Hope. It's an initiative of Salvation Army, and Washington County was selected and identified as the best place for brand new intensive case management and community collaboration and a bunch of other good things. But our goal, our aim is for providing sustained self-sufficiency. And so it's a new approach. And so I am hoping to meet and greet everyone in our community. I've done a lot of work. I was the executive director for the West Women's and Children's Shelter, and then White Shield before that, and then the Adult Rehabilitation Center counselor before that. So I would love to get to know everyone. I've only been here a couple of weeks, so I'm excited about investing in the community. So.
That's great. Thank you so much. Appreciate that announcement. Ingrid, and then Kimberly.
Hello, everybody. Good morning. My name is Ingrid Solares. I'm a licensed clinical social worker, and I just want to announce that Adelante Mujeres just is launching a new pillar of their services, which is the health equity pillar. And within that pillar is going to be a social and emotional wellness program called Esperanza, and that's going to also there's also other existing programs in Adelante Mujeres that's also going to go under there. So it's really nice to be here. It's really nice to meet everybody, and I look forward to connecting in the future.
Thank you, Ingrid. Kimberly.
Hi, I'm Kimberly Culbertson. I am the board secretary of Habitat for Humanity Portland region. We just broke ground on an 18-house project in the Century neighborhood of Hillsborough, which is really exciting because it's an excellent school, and our kids are going to be able to go to 3 really great schools and thrive in that neighborhood. Another thing that we're doing is we every year we have the Hope Builder lunch. And we are having that on the 26th of April at the Convention Center. So that's all. Thanks.
Thanks so much, Kimberly. Kelly Stover, and then Kemp.
Hi, everyone. Good morning. I'm driving my kids to school, so hopefully you can hear me okay. I'm the development director and any information about new routes or schedules for both the green line and the slightly adjusted red and blue line can be found on our website, on our community connector page. And then I also wanted to announce we're really excited. We just hired a brand new volunteer outreach manager, Katie, who's here on this call. I'd love for her to jump on and introduce herself if she's on the call.
Great. Hope everybody heard that. A new manager, Katie, and check out Ride Connection website for an update on their added transportation option on the Green Line. Let's see. So Kemp, and then Beth, and then my next door neighbor, Mary.
Morning, everybody. Kemp Shuey with Community Action, he, him pronouns. And just a couple of things to share. For us, our exciting news is on January 25th, we're finally reopening our doors to the public. It's been just about 3 years now that we were closed to kind of the general public, and just like everyone else, figuring out how you kind of navigate things and managing staff and people in the office working remotely and all these things. But very excited that our 3 service centers in Hillsborough, Beaverton, and Tigard will all be coming back online and open 8:30 to 5 Monday through Friday. So we have a lot of people who come in for appointments. They're usually scheduled, but we always have lots of people who also come in as walk-ins and need assistance. And I'm excited that we will have a strong, reliable, consistent staff presence at all 3 of those locations. So it's very exciting. So that'll be on Wednesday, the 25th. And then otherwise, we have our annual fundraiser that is called Kaleidoscope, and that's coming up on April 19th, and we'll be having it at the Patricia Reeser Arts Center this year. So it'll be a first time again coming back in person. And for those of you who've been to our event in the past, it's going to be a little different. We won't have any sit down meals or anything like that. It's going to be a little shorter and a little bit more impactful, hopefully. But we're excited to have people back again and doing it in person and trying something new in a new location.
So 2 reasons April 19th is important. Washington County Thrives quarterly gathering in person, and Kaleidoscope that evening.
Bookend your day.
Exactly. And Kemp also is the chair of Van's board, so we're happy to have him. Let's see, I think Beth was next, and then Mary. Beth, we're missing your audio. Even though it says you're not muted.
Because I have 2 mutes on just to make sure I'm covered when I'm on.
That's awesome.
Good morning, everyone. My name is Beth Cook, she, her pronouns. I am the Vice President of Development and Advocacy with New Narrative, and just want to let you guys know we will be having our annual gala luncheon on May 25th at the Multnomah Athletic Club.
Excellent. Thank you. And Mary.
Hi there. Like Cindy Miguel, I'm really excited to be here for my first meeting. I'm new in my role as the new Executive Director of the Community Housing Fund. Similarly, I just love to meet people, so I'm going to put my email in the chat. Look forward to it.
Great. Thanks, Mary. I think I saw Rachel's hand up. Yes, Rachel.
Hi, sorry, it's like a few minutes late, but here I am. I'm nice to see everyone this morning. I'm Rachel Duke, she, her pronouns. I'm with Community Partners for Affordable Housing. We are having a forum on ending homelessness on March 8th at the Broadway Rose Theater. And we have some awesome guests. The panel will be facilitated by Israel Byer, who used to be the director at Street Roots. And we will have Marissa Zapatos from PSU and the mayor of Beaverton, which is very exciting, like Mayor Beatty, and other really awesome guests there to talk about solutions. So it's a free event. It's in honor of our 30th anniversary, which is as we speak this year. So we're really excited about that. We will be postponing Homeward Bound until the fall. So we've kind of historically done our fundraiser in the spring, but we will now be doing our fundraiser in the fall, and I'll be promoting the heck out of that one. So that's going to also be great. But we're really excited to invite folks to come listen in I think we can I think there will be tickets because there's only so much space at the Broadway Rose, and I think it will be a pretty popular event. I'm hoping anyway. So it's nice to see everyone.
Thanks, Rachel. Anyone else before we proceed? All right. If something comes to mind, feel free to put it in the chat. And we will continue on. I want to share a little bit about what we've been doing in the Behavioral Health Initiative, which a couple of Thrives meetings ago, we kind of embraced this underneath the auspices of Thrives, given our focus on workforce, on housing, on supportive services, on early learning. Behavioral health seemed to be one of those issues near and dear to the hearts of people who are participating in this collaborative. And just as a reminder, the focus areas that we came up with way back when in March of last year were these four. There was a summit that we held, and essentially workforce development, just building the capacity of the behavioral health sector, was a key issue. And then providing some kind of immediate care and support for people in the sector, as well as folks who were trying to acquire services to support their behavioral health. And then childcare was a theme that came up pretty strongly, related to the challenges for both workers and clients. And lastly, some type of an awareness campaign to elevate the issue of behavioral health and to try to shore up the sector. And then embedded in these four thematic areas was the idea that we need to be focused on equity and inclusivity and diversity. And so the two areas that Van began putting attention into were the workforce development and the awareness campaign. And so we've begun working with providers on the capacity building. LifeWorks New Narrative and Sequoia, I think we've got two representatives from two of those organizations that I saw here in the room with us this morning. So we had that summit in March. We started working with the providers to create kind of a universal job description that they could use for their recruitment efforts. And then we hosted a virtual job fair in November. And that led to the idea that we also wanted to have an in-person job fair. And that's going to be happening this Saturday. And I'll talk a little bit about that in a moment. And beyond our large providers in Washington County, Van began having discussions with some of our culturally specific and culturally responsive providers. So Adelante Mujeres and Raíces de Bienestar are two partners that we are working with on a culturally specific cohort. And so the job fair and career conference that we're going to be having this Saturday is being hosted at Village Church. If you haven't heard about this, then you aren't connected to our newsletter. You're not connected to our social media or any of our partners, because we've been broadcasting this regularly and broadly since early December. Perhaps Jenny can put the registration link in the chat if she already hasn't, or it hasn't already. But we would love to see you there. This event is not only a traditional jobs fair where we've got 6 or 7 providers who are going to be tabling in their recruitment and marketing efforts. We will also be having an opening panel at 1 o'clock and that's my phone, that is going to include 6 different speakers. Let me think if I can remember them all. Representative Rob Nose, who's the chair of the Health and Healthcare Committee for the House in the state of Oregon. Dr. Ruth Zuniga, who's going to be speaking to you in a moment. We have Marcia Hilly, who's in the room here with us today. from Sequoia. We have Julie Ibrahim from New Narrative. We have Kevin Fitz, who's with an advocacy organization around behavioral health. And there's one more I'm missing.
Jill Archer.
Thank you. Jill Archer, who is the VP of Behavioral Health for Care Oregon. So the 6 of them are going to be in a moderated conversation with me, talking about their various perspectives on behavioral health. And then we will have some breakout sessions around career pathways in behavioral health, primarily for those who are seeking jobs in the sector. We'll have a Spanish speaking session that both Ingrid and Ruth will be moderating. We'll have a moderated conversation on a cross-sector collaborative that I will be moderating. And we will have a session on public policy and investment that I'm hoping Beth Cook is going to be involved in. Beth, I don't know if Julie has tapped you, but we haven't closed the loop there.
Only briefly mentioned. I still need details. So that'd be great.
Okay.
I'm
Well,
going to be.
let's you and I connect, because I really want you to be there. So that's what's going to be going on this Saturday. Last October when we met, I had shared with you that we were waiting to hear word whether we were going to get the HEC grant, the Higher Education Coordinating Commission grant. We did. So we will be working with Adelante Mujeres and Raíces de Bienestar on that particular grant effort. And before we get into housing and supportive services, I didn't want to click on that slide. This is the time that I want to transition to Ingrid and Ruth to share a little bit about what we hope to achieve with that culturally specific, culturally responsive cohort being supported by the HEC grant. But before I hand the mic off to them, does anybody have a question or a comment regarding anything that I've shared at this point in time? All right. If there are no comments, then let's transition to Ruth and Ingrid.
Gracias, Glenn. Good morning, everyone. Hi, nice to be here. I'm Ruth Zuniga, and I'm the executive director of Raíces de Bienestar. And the co-founder of Raíces de Bienestar is here, Bonnie Lerner, and she's going to be here for a couple of minutes. So I just want her to show her hand and say hi to people. And we're honored to be here. We will be sharing a little bit about the work, and we are very honored to partner with Adelante Mujeres and Van in this project. So thank you. And we didn't have a plan with Ingrid and I, so I'm sorry, Ingrid, that I just jump in.
Go ahead.
This is the
Okay.
Latino style comes here when we just start a conversation, and maybe we'll talk on top of each other. So Ingrid, I'll pass the microphone to you.
Okay, thank you. Yeah, it's very exciting to be here. I look forward to connecting with everybody and joining all of these really amazing opportunities to connect the network. And yes, we're so excited also to be partnering with Raíces de Bienestar and with Van. And yeah, I'm excited to share with you what the plan is for Adelante Mujeres. Yeah, would you like to go first?
Sure.
Okay.
I can go first. I would like to talk about our this partnership that Glenn was talking about, and the partnership that involves specifically the 3 organizations, Adelante Mujeres and Band and Raíces de Bienestar, within the next couple of years. Specifically, most of the work and the funding was for this year. And when I say this year, is this fiscal year, which, believe it or not, will end in 5 months. So we have a lot to do in 5 months still, but it is possible. But our hope is that with this work, we start something that will be more long-term. However, before explaining a little bit of that grant and the collaborative work, it will be important for us to talk a little bit about, at least for Raíces de Bienestar, to talk a little bit about ourselves and our organization, just because we are a brand new nonprofit we are housed in Washington County, but we serve the entire state of Oregon. Raíces de Bienestar, we actually are we found co-found Raíces de Bienestar in 2021, June 2021, but became fully independent from our fiscal sponsor. We have United Way of the Colombia and Willamette as our fiscal sponsor for 1 year, but we have been independent since June of 2022. So what is Raíces de Bienestar? And what it means is roots of well-being or roots of wellness, because that is how we envision and perceive mental health in our state and beyond, which is not only about pathology, it's not only about illness, but it's about mental health, well-being, emotional health and wellness as an equilibrium, as balance, as something that encompasses prevention, but also intervention. So it is a way to see mental health beyond, again, pathology, and not only focus on mental health as a modality that is only focused on treatment or let's help the individuals when the individuals are suffering. But instead, what can we do now every day in our communities to foster healing, to foster well-being, to foster prevention, and to work with the people that are already doing beautiful work in the communities, like community health workers, traditional health workers, community leaders, the moms that maybe are picking up their kids from school, the neighbors that are helping each other in different ways. All of us, we believe that all of us can contribute to the emotional well-being and emotional health of our communities. So I'm gonna ask I didn't have planned a presentation, but I want to give a visual of our work, and then I will talk about how one of our work, how this grant relates to one of our specific pillars. And Ali or Glenn, I'm gonna ask for a option to share my screen. I think I do have access.
I'll work on it. I'll get you there.
Thank you. Got it.
You got it.
Can
I didn't
people
have to
see
do anything.
this? Can you all see this? Can see yes or no?
Yes, we can.
Okay, great. So this is the 3 pillars of the of Raíces de Bienestar. Our mission is to improve the health and well-being of the Latinx, Latine community in our state. And we do this through 3 components of 3 programs. One program, and this is the program that was the program that we call a Community Liberation Program, or community-based prevention, community-based work. And this is how Bonnie and I met in 2017 when we were in our respective institutions. Bonnie was at Providence Health System. I was at Pacific University, where I was a professor there, and where we met because there were some funds available, because there were some need assessments that were done in the community, where the community and community leaders, and especially faith leaders, have expressed that one of the biggest concerns in the state were the unmet needs of mental health unmet needs of the community. However, one of the things that we hear over and over again is mental health is a need. Many people in the community, like traditional health workers, are supporting the mental health of their people, but they may not have the skills, they may not have the training, they don't have the recognition, like nobody recognizes them for this work. And the other thing is, doing this kind of work can just lead to vicarious trauma, compassion fatigue, and other concerns for the same people that are serving the community if we're not supporting them. So at that time, we started a program where we focus on working with traditional health workers. Specifically at that time was promotores de salud, to train them on emotional health and wellness topics, so they will have the skills and the capacity to serve the mental health needs of the community. So that's how we met many years ago. I want to put here, or maybe Bonnie can put our website information if people want to know more about it. So that's what got us together, and that's what we became and work during the last several years. And so what does it mean is that when we think about community liberation, is working alongside people in the community so they can be catalysts of mental health and well-being. When we can train with them, we can provide them skills, and together with them, we go to the community to support the mental health and well-being of the community. We do this through trainings. We offer community conversations that we call charlas de salud emocional. We do them in person, we do them online. I saw Brian here from Centro Cultural, from Casa Amparo. Actually, when we came back from the pandemic, the first charlas about emotional health and wellness were held with Casa Amparo participants. So that's one of our work. And then our other works is direct clinical mental health services, when we understand that even if we do all the prevention work, there is gonna still need people who need traditional mental health services treatment. I'm a licensed psychologist, and I worked for many years as a supervisor of future psychologists and mental health providers and professionals. So, and I have provided mental health services for several years now, and before in Alaska and then in Oregon. And so we knew that there needs to be a direct path from the community to clinical services. And so Raíces de Bienestar, we are also working and focusing on mental health services. And the last thing that we have here, our last pillar, is organizational capacity building, because we know that we need more people in the community doing this work. We need more providers who are culturally informed and culturally responsive, and also culturally specific. And therefore, our foundation of our work is that our work, and what we see is that everything that we do, in order for us to continue to these pillars of work, of mission, of care, we need to continue implementing different modalities and capacities that will lead more people to be able to work go into the pipeline of mental health. And we have to focus more on that workforce development. So together, so it is not only Raíces de Bienestar, it's not only Adelante Mujeres, it's not only a small group of people who can serve the mental and emotional health needs of the community. So I'm just going to stop here, because I wanted to say about that, about Raíces. So Ingrid, maybe you can say about Adelante, what is the work, and then I will explain which of these is the work that we are doing with the HEC grant, which is in two of those pillars of work. And yeah, but I can speak for many hours, as you may imagine already. So I'm gonna pass the word to Ingrid.
Gracias, Ruth. Thank you for that really inspirational presentation. There is so much work to go around, and I'm excited to partner and work with you going forward. Can I also have some sharing capacity? Oh, do I already have sharing capacity? Oh, yes, I do. Okay, I'm going to share some really quick. Present. So there's a lot of similarities with Raíces de Bienestar and Esperanza, and believe it or not, we were not that much in communication during this time. It just seems like this is kind of like we have kind of the same thoughts about this. Yeah. So Adelante Mujeres, as you all know, is an established community-based organization in Washington County that's been going strong for 20 years. And in the last several years, Adelante Mujeres has been doing their strategic growth planning. And we went to the community and we asked, what more can we do? You know, what is Más de Adelante? How could we provide more services? And the community said that they wanted mental health services because it was so badly needed in the community. So this is the three existing pillars of Adelante Mujeres, which is already, in place. The fourth pillar is the health equity, which Esperanza, the social and emotional wellness program, will be under this, beyond trauma, and also health and nutrition, including community health workers, child nutrition, and the produce prescription program that is in partnership with Virginia Garcia. And I just wanted to speak a little bit about the problem overview. We did do some focus groups early on to gather information. We wanted to go to the community to ask the community, what are you seeing? How can we help you? And this is what we got back, from the focus group. So, as we all know, current mental health programs are not designed to meet the needs of our community. And I'm talking about like the existing programs that have been out there for a while. Limited access to culturally and linguistically responsive providers, supervisors, and directors, limited access to mental health for uninsured people, and limited access for mental health care for insured people as well. The mission of Esperanza is to develop, provide, and model culturally and linguistically responsive and holistic mental health services that reduce biases to mental health and lead to healthy lives, strong families, and community resilience for our participants. These are the desired impacts. Let me move this a little bit. Oh, that's in my way. So the intended impact is we want participants to feel liberated to seek support for their social, emotional health and wellness. We want participants to break the cycle of generational trauma. We want participants and their families to feel safe and grounded. We want participants to feel an increase and sense of belonging and cultural resilience. And we want our staff to develop the capacity to perform their job effectively and are committed to serving the Adelante Mujeres community. And these are the guiding frameworks, the guiding theories and frameworks that were used to develop our program. So trauma theory, we know that we can't do that really good work if we're not trauma informed. And that begins as you're walking into the building, who you see, what the chairs look like, and all the way through. And the trauma theory is really important, as well as Adelante Mujeres as bases most of their programs or all of their programs on popular education. So that's going to continue here. And Liberation Health is Liberation Health was drawn from popular education. And this, we see our participants as having very valuable lived experience, sabiduría, a lot of wisdom, a lot of intelligence. And we want to begin with that. And like Ruth was saying, we want people to not just, we don't want to just help them to cope with, we don't want them just to cope with like the symptoms of oppression, but we also want to help them, to seek liberation. And then decolonization, that means that we want to challenge existing systems. We want to challenge and push for transformation, to do things different for our community. And so this is the care model. As you can see here, so tier 1 is going to be like a social and emotional wellness campaign, which is like universal health. This is going to be an education and promotion campaign. The intended impact is to destigmatize mental health in our community, to provide psychoeducation for the community at large, and promote mental health and wellness and awareness. This will be in Spanish and English, and also in Spanglish maybe. And this also may include interviews with mental health professionals in the community that are already doing the work. And this could also be interviews with community members that have gone through the mental health system, and just just to help people with the stigma. Tier 2 is community workshops in support of health, and we want to help integrate occupational therapy with mental health. And those of you who are not aware, who don't have a lot of understanding what occupational therapy is, I'm happy to put something in the chat for you all to read later. But basically, let's see, these are going to be value-based groups informed by the participants and facilitated by traditional health workers. and overseen by occupational therapy. The intended impact here is to heal in community, connect people more with their values, engage in occupation-based activities such as like gardening, all kinds of groups. And the intended impact is to heal in community, to increase connection and belonging. And this will also help with overall wellness. We know having a sense of belonging is really important for the mental health, and we know that the impacts of COVID were really detrimental to people's sense of belonging, which increased a lot of isolation. And then tier 3 is going to be the direct mental health services as well, including individual, family, and group counseling. And another part of that is having student interns and training them, providing them with culturally and linguistically responsive supervision, because that's very, very important. And this would look like a more of a traditional mental health program, but with supervision, group supervision, and just a lot of guidance and a lot of care. And we're using cultural humility, usually using trauma-informed care, and also centering the identities of the mental health practitioners, that are coming into the workforce. So I'll stop sharing there. And thank you very much for letting me present.
I'm curious if anyone has questions for either Ruth or Ingrid on this. Thank you so much to both of you for presenting such wonderful material. And I also, go ahead, Ruth. No, please.
I wanted to say that, we presented about organizations, but we haven't necessarily talked much about the HEC grant. And so this could be a good time, Glenn, to present, at least that if you have specific questions. If not, I can share our work in regards to the grant.
Yeah, I was going to give just a very broad brushstroke of that, at least from Van's role on this grant. So essentially, we applied for a first round of funding with the Higher Education Coordinating Commission. There was roughly $10 million awarded to, I want to say, 47 different projects. And as Ruth mentioned, it's technically from July 1 of this last year through June 30th. We've yet to get our contract. The first contract was finally executed this month. We're told ours is coming soon. But we are allowed to take into account activities that have been taking place since July for the purposes of the award itself. And essentially, the conversation that I had with Ruth and with Bridget Cook, the executive director of Adelante Mujeres, was how about we bring our organizations together, and Van helps provide support. So we're going to be logistics and communication support. We're producing some videos that will elevate the work that's being done. We will coordinate if there's any type of consultative expertise or training that both organizations can benefit from. So where there is overlap in the two organizations' work, Van will help weave those activities together. And so Raíces will focus on its efforts around traditional health workers and expanding its capacity in that regard. Adelante Mujeres has a goal of developing an actual mental health clinic that will be serving the Latinx community. And of course, Ruth and Ingrid, if you have some specifics you'd like to share in regard to the activities associated with the grant, please feel free to do that. But that's essentially what we're planning on doing. And the effort, of course, is long-term. We are as excited about working together on this project in this very near term, but looking beyond this first round of funding to the subsequent year. I think there are 2 more rounds of funding, and we hope to expand that work and dive even deeper into these efforts. and we may involve others in that collaborative. We haven't really dreamed up what it is we're planning on doing in round 2, but we definitely have an intention in submitting a proposal for that. So, Ruth, Ingrid, anything you would like to add to that?
Yeah, thank you, Glenn. Yeah, thank you so much for putting this together and working together, and just to these funds have been instrumental for us because we have been, as a new nonprofit organization, you can imagine how challenging it is to find resources and funding for general operations, but also to continue the programs and expand the things that we were doing. We actually, as a new nonprofit, we were able to offer mental health services to our community, but through a sister partner or another partner who allow us to borrow their infrastructure in the meantime, and that is Northwest Catholic Counseling. But we cannot be under umbrella for a long time. So the funds allow us to dedicate more funding to our mental health services. So that means that thanks to this grant, we increase the capacity to see more individuals for mental health services. Our mental health services currently are all free, because all are funded through grants, and we don't have yet any contracts with any providers or network providers or CCOs, or we're not part of any network of insurance, and therefore they allow us for some flexibility as long as we have funding. So thanks to the funds, we are able to increase the number of people who we can see in our mental health or provide mental health services. Or our mental health services are done through telehealth. At this moment, we actually put in the grant that we will see 50 families throughout this time, and we actually are already at 36. So we're very close to get to there, and we will continue seeing more people, of course, at that time. Our services are provided in Spanish or bilingual. However, 90% of our current patients, 93% of our current patients, so pretty much almost everybody but one person are Spanish-speaking individuals. Uninsured, many of them, and again, we have, our work is in Washington County, but many of our work is across the state. So many of the people that we are serving are also people from Southern Oregon, which is where we have other partnerships as well. The service is provided by a team of doctoral level and master level student clinicians, people who are in training. We have currently 4 student clinicians, 3 doctoral level and 1 master level clinician. We also have 2 psychologists in our clinical services, and through the grant, we are able to provide our student clinicians a better training and more formalized training. We are also able to provide them some sort of compensation, a little bit of support, because if you remember, if you went to college, you know how expensive that is, and graduate school is even more expensive. So we want to provide that, even if it's a little bit of cushion for our students. The grant help us to do that. So it helped improve our training model in a way that students are able to receive more support. There is only 3% of providers, mental health providers who identify as Latinos or Latinx in the state, 3%. And when it comes to doctoral or master level, the number gets a little bit more complicated. So that means that many students and many people who are in training right now, master level, doctoral level students, when they go to practice, very few have the opportunity to receive supervision in the language that makes sense to them, or receive supervision that is culturally informed and culturally appropriate. So by us providing the opportunity for the students not only to serve their community, the community that they belong, because the 4 students are all Latinx individuals who are bilingual as well. So we are providing the support to them, but they also receive supervision in their language. We the culture, and also they're able to work with their community versus working in other settings. So that's a big component of this grant. The other components, which is we have our traditional health workers trainings that we continue doing throughout other grants, but this grant help us a little bit just to have some coordination and some support. And the last component of the grant is that we have some convening work where we can see and we can work with some of the partners in the county and in the metro area who are seeing who are interested in creating pathways for mental health and behavioral health within different professions. And so that's a little bit of convening that we are doing as well there. But much of our work goes into the supervision, support, training of the students and the mental health services to the community. So yeah, and any questions, please reach out to me. I'm gonna put my email here in the chat. Thank you.
Hi, yeah, I just want to add the importance of what Ruth was saying regarding culturally responsive and culturally linguistic supervision, clinical supervision. It's so important, and it also really helps to protect clinicians who are doing the work and reduce vicarious trauma, I believe, as well, because having somebody that looks like you and that can speak to the experiences, having a clinical supervisor that you can really connect and relate with is very, very important to the well-being of the clinician. And also that translates into better quality mental health services to the community. Yeah. If I could share just a timeline, because as Glenn said, we're starting up. Oops, sorry about that. Share. Oh, there it is. Okay, I just want to share the timeline and where we're at and where we the trajectory of the program. As you can see, it's January right now. Oops. And Adelante has hired the director of Esperanza, the director of health equity, which is me. This is starting a new role. And I believe part of the HEC grants is also going to this in order to, we had to get the director going so that we can start to roll everything out. So we're going to start off operating in the existing building. We currently have submitted, and we're this close to getting the certificate of approval approved. And this means that we can begin billing for the services. We're going to be recruiting clinical supervisor and an occupational therapy manager around April. And then in July, clinic manager, we're hoping to be operating in a new building by then. And then in August, the QMHP, which is a qualified mental health professional, and traditional health workers will begin. And then in September, we'll have the student placements. So this is all it's happening. We're very excited, and we're very grateful for all the support from the community, county, and the state, and Van as well. And so yeah, so we're launching this, and it's happening.
Such great stuff going on. This is a long time coming, so I think we're seeing a change in the tide in a good way. Thank you both. Does anyone have any questions or thoughts? Well, I appreciate you both taking time today to be with us, and you're welcome to stick around for the next agenda item, or if you need to move on with your day, feel free to do that. So we will, I know that I got word that Jess Larson won't be able to join us, but we do have Liz and Leslie who are available and ready to share an update on some of the progress as well as the plans moving forward for Washington County's housing and supportive services. For those of you who may not know, there was we've got the affordable housing bond that passed in, I think, 2018, I want to say. Boy, time is flying. And then about a year later, the supportive housing services measure. So both are well underway, and I'm looking forward to hearing from Liz and Leslie on all of the stuff that's been going on from the county standpoint. So I'm going to let the two of you take the baton and run with it.
Thank you, Glenn. I'm going to share my screen. I can do that successfully. Okay. Can you see my screen?
It's coming up. Yep.
Okay. Great. So good morning, everyone. I'm Leslie Gong. I'm the Affordable Housing Program Coordinator with Washington County Housing Services, and I'm here with my colleague, Liz, who will be joining us in the conversation. Liz, do you want to give an introduction?
Good morning, everyone. Liz Moore, she, her pronouns. I'm the Rental Assistance Program Manager for the Department of Housing, so overseeing the vouchers and the regional long-term rental assistance, so any subsidy that comes in to the department.
Thanks, Liz. So we're here today to share with you about our budget planning process and get your thoughts on areas of unmet needs within the housing work. See if I can advance my slides here. Okay. So during our discussion, we'll have a high-level refresher on housing services and our process, and spend most of our time getting group feedback. So in discussion. So as mentioned, we want to gather community feedback that will inform the work of the department and partners to sustain and build housing services in Washington County over the next year. It's important to note that the budget is primarily fixed as so the input gathered today may not be weaved in, but can inform future budget plans. And we're aiming to really continue the dialogue and explore and build solutions together. It's going to be an iterative process, and we're knowing that at the year-end outcome may not be perfect, but as mentioned, we'll continue the work, and knowing that the results may not be immediate. So as we go through the presentation, some questions to consider is what solutions to address housing and homelessness are most important to you and the community you serve? What does it mean to you to advance equity with our budget commitments? And what are the unmet and or ongoing needs you see in our community in Washington County that can be addressed through budget priorities? Okay, so talking about housing. So the Washington County Department of Housing's mission is to provide a continuum of affordable housing options that promote community strength. And with that comes a vast network of collaborators to ensure that that mission moves forward. And it's difficult to capture the number of collaborators in its entirety, but all partners are key in that work. And so I'll hand it over to Liz to talk about our commitments with EDI work.
Okay, so Washington County as a whole has a commitment to equity, inclusion, and diversity, but the Department of Housing has gone even further in making sure that we are understanding the diversity of our staff members, of our participants and clients in the community, understanding and bringing that inclusion to that participation across our committees and our boards, and as policies are being made, and making sure that there is that equity. So we want to make sure that we are looking through lenses of all different aspects as we are making sure that as policies are coming up, if we're able to change or adjust them to ensure that procedures are equitable and easy. And even in addition to that, we want to also make sure that belonging is being brought into that question as well. And so that folks feel like they have that sense of belonging when they're working with the Department of Housing. So we also, in part of our commitment, in addition to some general workshops, which the county does do, which is fantastic, the Department of Housing is working with Cultural Solutions to engage and make sure that the staff members are going a little bit more in depth. So they've been doing some assessments over the last couple of years and have a very high course of workshops going on, as well as some subcommittees, again, to kind of ensure that as we are looking at policies, whether it's in a room with 2 people going over how are we going to roll out a new wait list, or if it's in a bigger group and bigger session, we want to just make sure that we are looking through that equity lens.
Thanks, Liz. Okay, so we're diving into any available data that we could capture. We wanted to learn about the populations we serve. So based on estimates and a snapshot, we know that the number of individuals who have been leased up has increased by 20% if we compare from 2019 to 2022. And most of that growth has happened between 2021 and 2022. And that's, as we can see, the increase in funding and growth in programs. Also, we find that of the participants being served through the department, looking at the demographics, the individuals who have selected Pacific Islander or American Indian has increased by 85% and 125% respectively, though as a whole that group of individuals that is the makeup of the participants department-wide is relatively small. And then looking at other key findings that we see here is that individuals who have reported Hispanic or Latine has also increased by 9%. And we hope to continue this work of really pulling in information so we can learn more about the community being served. Our work and services are driven by 5 key areas. So that includes policy and strategy and equity. That really is our roadmap and our guide for the work that we do. We also have the finance division that sustains the funding to ensure that that the work can continue on. And then we have the 5 key divisions: homeless services, rental assistance, development, and asset management that really implement and maintain the work in collaboration with our partners. And then some of that work, for example, includes the recently acquired Aloha Inn for permanent supportive housing, the images down below, and the Val-Free, which is a recent affordable housing development project. And then the AHP4 projects, which include improvements and rehab of existing properties. So we just wanted to share one of our program participants who has a really insightful quote. To anyone who needs it, this program is where it's at. It has helped change my life. I now have a new life. I am able to care of myself now, mentally and physically. It's changed my life. And this is a participant who has been traveled to the Pacific Northwest, had entered into one of our shelters, and then also became a voucher recipient or for the regional long-term rental assistance, and is now, at a place, a point in his life that is gearing towards stability. So a really insightful story to share here. And so the number of housing services and programs intersects across these different 5 areas. So in addition to the capacity building and development projects, there are programs related to employment and training opportunities, education opportunities, and pathways for home ownership. So the number of programs is vast. So this is a timeline of our budget planning process. We want to continue to engage and hear from the community, and that will guide our budget plans moving forward. As mentioned, the current budget is primarily fixed as we're kind of near the budget submission, but we want to continue that dialogue. So here we are in January. I want to share key dates. So other opportunities for engagement is the quarterly County Community Partner Street Outreach Meeting on January 26th and the Housing and Supportive Services Network February 1st. And I'm confident that there will be more opportunities to provide feedback. Okay. So this is a broad overview of the funds showing budget revenue for 22-23. For context on the distribution of funding across the department. Here in this table is a list of and a snapshot of the different projects which this funding helps support. I will mention the Metro Affordable Housing Bond is one that includes 10 projects, 2 of which are completed, 7 of which are under construction. And that funding is being drawn down over the next, I think, year or two. And so there's a remaining 13 million that will be up for board approval. So that's the remaining allocation for that Metro Affordable Housing Bond. It's really impressive to hear that of that funding, that produced 959 units, and which exceeds the local implementation strategy goal of 814 units. So really great work there. And there's a lot going on. So Liz, is there anything you want to add or highlight?
Well, we're just keep growing and expanding, and it is amazing to see, especially coming from other housing authorities. I've been here for 3 years, but that is just not something that you get to see as often. The capacity of funds to be able to serve as many individuals who obviously need it in an area that needs affordable housing. So it's just been exciting to be part of it, and knowing that in the next couple of years, as we just continue to grow our overall capacity, I'm impressed. I think that's kind of self-serving that I'm impressed because I also work here, but it is impressive. It's exciting.
Yes, it's very exciting. And yeah, we want to continue improving and building. And so I look forward to hearing your thoughts. So I'm going to pull up, I forgot to mention, yes, this is important. As we talk about, all of the development and capacity building, these are areas that we also allocate funding for, which is accommodation, translation, interpretation services, community engagement opportunities, culturally specific services, improving the outcomes so that we can close the gaps in inequities, improve access and quality of services, and then culturally specific equity, diversity, inclusion focused professional services. And that includes staff training, including training for providers, research, and consulting. So yeah, another important part of that distribution of funding. So here are the questions that we have. So this is, we want to spend this time learning from everyone and hearing your thoughts about how we can continue to grow the work and move things forward.
Great, thanks for posing these questions. Give folks a chance just to take this in and see how you might care to respond.
And we're happy to take questions or elaborate on any of the content.
Thank you. Appreciate that.
Marcia?
Yeah, hi, Leslie. This is Marcia Healy from Sequoia. I appreciate very much the overview. We work pretty closely with housing, but I must admit, I did not have a complete grasp of all that's going on. So it's really been helpful to hear. A couple of questions or I guess requests of you. With all the growth and the services available through housing, it's been very difficult to figure out who to contact for what because of the growth. And so it would be helpful, at least to us as a provider, if we had a org chart or a way to get a hold of key contacts and who those people are. I think also the availability of services to consumers would be helpful to have that more readily, that kind of information more readily available. In terms of the solutions, I guess, again, more of a question than this answer to your question. I'm wondering if the county is making any progress trying to work with existing apartment owners, landlords. Clearly, the building that's going on and the resources available to do that is wonderful and much needed, but I don't think we can entirely build our way out of the lack of housing in the community. So curious about those efforts as well.
Thanks for that question, Marcia.
So and Liz, maybe you can elaborate more on that, because I know that there's a lot of work going around capacity building for units. So there's growth and development projects, and then I think it's a landlord liaison program to help support that relationship.
Correct. Yeah, we do have our landlord liaison program, and we're also expanding our owner services team to kind of help support our current landlords. But I think as far as even just continue to have the opportunity for current landlords and owners to potentially get into, if they are keep their affordable housing or look at other opportunities, as we have any fundings of NOFAs that are released, there's always the opportunity potentially there for applying. It's not just always for new development. It's just as long as it's expanding that growth is part of what the goal is. So it's very helpful question, and thank you so much. And thank you for your question about who to contact. I know we moved to a Teams model, so it is very more specifically like just Teams emails to contact, because when we have caseworkers, turnover, it's really hard that nobody's capturing that email because that email is locked by that person versus like other people being able to check like a general box. And our website is getting a big overhaul. So hopefully, I'm hopeful, Marcia, that in like the next few months that we'll be able to have a little bit better online for our participants to be able to see what services. A lot of our services are more referral based, so they actually don't start with us, but they can still at least see that map as to how to get to where they can be served, as well as to make it clear for our partners of like, who do I contact and what is the best way to get in contact with the folks that we need to talk to.
Great. I see there were hands raised, Kimberly and Kemp. So Kimberly?
Thank you. I had a quick question about, so much of keeping people housed is keeping people in the houses that they have or they may be living in. Is there any room in your program for critical home repairs? It often has ramifications in terms of intergenerational wealth and seniors being able to live and age in place.
That's a good question. And I don't know if I can answer that very specifically in the sense of like programmatically of like what the specifics are for this new program that's going to be launching in the next year, which is to kind of help with those like one-time costs. I just don't know the eligibility, if it is only for those who are renting, so to avoid eviction, or if it also could potentially help people who maybe own their own home. So that's the one thing I cannot answer for sure. I just want to be clear about that. But I do hear that's a really good, the scope of the affordable housing bond, the SHS supportive housing services, like that's where it's like trying to meet multiple different places. So one of it is that kind of one-time, what's that one-time thing that can help so somebody can maintain their income or maintain their housing? Maybe they don't need that supportive housing. They don't need even short-term rental assistance. They just need that one-time help. So that is coming online. Like I said, I just don't know the specifics of like how somebody is eligible, if it's only for those who are renting, which I know it definitely is for that. I just don't know if it also includes potential homeowners already.
Yeah, and you know, one thing that we're learning here at Habitat for Humanity is, you know, we have a huge amount of demand for our critical home repair program, something that Portland East had never done. And now we're you know, leveling that out around the entire metro area again. So it's astonishing how many people can, you know, miss a mortgage payment or 2 or 3 just because they haven't fixed their roof or fixed their gutters or something like that. So it's always present.
Yes, no, thank you so much. That's a really great point for us to bring back as well. Thank you.
Thank you.
Thanks, Kimberly. Kemp and then Cole.
Thanks. Well, just a couple of things. I mean, I think you all know from our perspective, certainly continued support of rent assistance is critical. Just want to put a vote in for the importance of that. That doesn't feel like that is going to be changing or going away anytime soon. So, but I think the other thing from a service provider on the ongoing needs we have is related to our workforce needs, both from, you know, the role and work that our frontline staff do with case management level work, being able to pay competitive wages as a nonprofit organization. And that's, you know, for us, we're competing with you as well at the county level. I know Community Action probably isn't unique in the number of staff who have moved from a nonprofit organization to work for the county, which is exciting and great, but does have impacts on nonprofit providers as well. So that is really important, as well as the emphasis. It's great to see that we're talking about the overall health and well-being of our staff, because you know, the presentation at the first half of this meeting very much hits on the challenges. It's not just pay, but how do we maintain a good balance and well-being of our staff. So reasonable caseloads, making sure we have enough funding for enough staff to manage reasonable caseloads. And then I will also just add the final pitch is making sure we've got enough administrative funds to do this work as well, because it's not just frontline work that happens. There's a tremendous amount of tremendous expectations that are being put on nonprofit providers to scale up tremendously, from data collection to monitoring to managing all of these funds. I mean, this is a tremendous scale up for everyone. And so we are still building a lot, and there's been a lot of changeover and turnover across all organizations. So a lot of knowledge has been moving around. A lot of people are starting new and learning, and we need the administrative capacity to stay current. And, you know, 10% isn't enough. And I know you all know that, and you've been good advocates. So just continue to toot that horn.
Thanks, Kemp.
Thank you.
Cole Merkel.
Hey friends, Cole Merkel with Here Together. So I really appreciate that Washington County is doing this level of community outreach. Thank you, first and foremost. I want to say that. And obviously we know that budgets are part of a two-part package. You have the money that you're spending, but then you have the outcomes that are associated with it. And I understand the outcomes will be outlined in the work plans that go to Metro. So I'm curious if y'all can kind of share, if I missed it, whether or how those numbers will be set, like what the outcome targets will be, and where the community engagement opportunities are for those.
That would have been a really good question for Jess Larson, specifically about the Metro outcomes and how they're kind of outlined. I think that, and there was the one slide that did show kind of like our capacity of like kind of going up to like 2,000 of permanent rental assistance, 400, I think, shelter or rapid rehousing, and then I can't remember the other specific. So there's so there are, as far as the feedback for that outcome, I think that there are some additional Metro and community meetings that go. I just don't know that time period. I'm sorry, Cole, and maybe that's something that we can loop back into this group for future to answer that question, or to you specifically. Yeah, so I don't know if that's just through the Metro pieces of it, or just part of our quarterly things. There is the I know the HPAC and HISTN meetings also usually have a lot to combine with the supportive housing, homeless services arm of the Department of Housing. Yeah.
Thank you.
Sorry. Thanks. So I do have this timeline. I agree with Liz. I think Jess could speak to this more, but just as far as the timeline, I think April 15th is the SHS work plan, which is due to Metro. So that might be a key date. There are, as Liz mentioned, there are other opportunities like the HISTN, another area for to provide input. And throughout the year, I think there's going to be more community engagement discussions around not just only about like budget, but plan, areas for improvement that we continuously build into the plans and the budget. So, but as far as, looking to outcomes and measures and keeping track of that, our goal is to create that feedback loop so we can keep everyone informed about that progress. And I think there's work underway related to dashboards and more data being pushed out so that everyone's informed and we keep that that progress transparent with everyone.
Wonderful. Any other questions for Leslie or Liz? There are things being put in the chat. I included a survey. It's important for us to really understand what kind of impact these gatherings have for folks who are participating. So if you'd be so kind as to, I'm going to put that link in there again, take a moment to answer that survey. And, one of the questions is open-ended, and give us as much detail as you're willing to share. Van, we engage where we feel like we can have some impact. We need to be able to demonstrate that impact to those who are supporting our work. So your feedback is important in that regard. That's my little station identification break. Anything else before we bring this quarterly gathering to a close?
Hey, Glenn, I will just say thank you again for bringing this. This was a great conversation, great presentations today. And so putting on my board chair hat for Van, I will just ask everyone on the call. I hope you'll continue to keep these Thrive gatherings on your radar, on your calendar, and certainly encourage other members of your organizations to attend, or if there are other partners in the community to please attend. Van is a unique organization in our region, really, in terms of bringing people together to collaborate and convene. And priorities, this focus on behavioral health in particular is a great example of how Van is able to be flexible and nimble in its work. And really important community conversations start here. And it's a great gathering place from so many different people from so many different sectors coming together to present, to listen, to learn what's going on. So I hope you will just continue to attend. We love having everybody here in this space. So thanks to all of our presenters. Thank you, Glenn and team, Jenny for and Allie for organizing and coordinating. And if you can make it on Saturday to the cohort at Village Church, look forward to seeing you there.
Yeah. And we didn't mention anything about Advance, which is where the nonprofits and funders come together. I know a bunch of you are already signed up, but if you haven't signed up or haven't even heard of Advance, we've got, I think, 175 people now registered. And it's in person. So it's going to be a heck of a party next Tuesday. You can find that more information on our website. So with that, friends, thank you so much for spending this time with us. Hope you have a great rest of your day and week. Yeah. Good to see you. Be well.